Phillip here again with a video for you. Today my topic is B12 deficiency. So what I would like to discuss with you, some common causes and just a little information about the deficiency. So what vitamin B12 is, it's an essential B vitamin. It's used to break down or synthesize protein. It builds genetic material found in basically all our cells. So when we're talking about red blood cells, white blood cells, myelin. Myelin is the covering of our nerves. So it helps to keep that covering and that lining secured on the nerves. Common causes of B12 deficiency. Again, it does a lot for our cells genetically. Red blood cells, iron, white blood cells, immunity. Just think about those things. Common causes would be low stomach acid. So there are times when stress may change how you digest your food. Certain medications also, or drugs. Again, a decrease in B vitamins or even zinc could cause a decrease. Age is also a factor. The normal pH in the stomach is between 1 and 3, and it's enough acidity to break down the food. You need to get iron and protein especially from your foods, and without the acid in the stomach, you will not get the breakdown that you need to achieve or even receive the nutrients that you need just for cell function. This is not a dietary deficiency, so it's not a lack of receiving it from your foods or even supplements. I'm looking at it from a stomach acidity problem. Okay, so some of the clinical signs that we see, you may have some acid reflux, bloating. There might be a glare here from the window, but I can just read it off to you. Again, acid reflux, bloating, gas, GERD, which we can talk about another time. Some additional clinical signs would be pale skin, fatigue, memory loss, neurological dysfunction, so numbness and tingling in the hands and feet. Again, B12 is essential for building myelin, which is the covering of the nerves. So when you don't have enough of that vitamin to help produce these connective tissues and coverings and linings, you will have an increase in symptoms. Anemia is another clinical sign that we look at. When we're talking about the red blood cell formation, B12 is essential in attracting iron into the red blood cells, which is what we need. And when we don't get enough iron, we get anemia, and there's a few different types also with that. I wanted to just also regarding the age. So there's an age kind of like requirement. So they're about 1/3 of 65-year-olds and above that do have a B12 deficiency due to the low stomach acid. Now I want to go back to it not being a dietary deficiency, and I want to just add this side note here. No animals produce B12. And I want to say that again. No animals produce B12, including us. When you think about cows and chickens, they typically eat grass and vegetables. B12 is sourced from bacteria in the soil, so plants are absorbing the B vitamins, and it's becoming a complex of vitamins. So when you see animals eating just grass, and yet we tend to get our B12 from meats, it says a lot there. It says a lot. So I just wanted to make that a note. What we can do to improve our stomach acid, going back to the low stomach acidity, what we can do is, a suggestion I like to give is to drink some apple cider vinegar. So it is acidic. You have to be careful in drinking it. Drink it with water, use a straw. I suggest a tablespoon to about 12 ounces of water in the morning, and that will help increase the pH in the stomach. That way, your stomach can digest the foods. You don't have a reflux of acid going into your esophagus. The valve is going to shut. You're not going to have that reflux, and you're going to get a breakdown of your food and extracting the protein and ions that you need. And I like to also throw in there, eat more vegetables. I mean, if the cows are eating vegetables, I think that, we should too. So I want to leave you with that. And if you have any questions, feel free to leave a comment in the comments below. Like, share, and subscribe.